Howdy everyone, my name is Tiffany LaCour, and we are doing our project over how social media affects mental health. Moving into the overview of historical context, in the 2000s is when social media first made its breakthrough. In the early 2000s, we were still understanding social media and how it worked. So around that time, I want to say around 2003 is when MySpace came out, and that was our first ever social media. So we were still starting to understand how it worked and everything like that. Although in the late 2000s is when mobile phones were created, and this started the idea of social media apps. A few examples of social media platforms that were created were Instagram and Snapchat. From the 2010s to now, TikTok has been created, and we went through the COVID-19 pandemic. Within these last 10 years is when we started to notice that social media was affecting our health, and it majorly became a big part of history during COVID because everybody was trapped in their homes, and so all they could do was get on their phone and scroll through social media. Moving into the overview of the key topics, these are going to be the topics that we touch on later. Body image and self-esteem issues. All ages are trying to compare themselves to influencers online and believe they aren't enough if they don't look like them and act like them, and if they're not keeping up to date with what everybody else is doing. Cyberbullying and online harassment. Mostly children and adolescents are being harassed by others online. So that means being made fun of, different things like that. Depression and anxiety rates are increasing among users of social media. There seems to be a correlation between social media and increased rates of anxiety and depression. And then digital addiction and compulsive behaviors. Among all ages, there is an addictive behavior with social media, and they spend most of their time on social media instead of doing other activities. Moving into an overview of our solutions and limitations. So a few of our solutions are age verification requirements, usage limiters and warning systems, mental health awareness and campaigns, and digital literacy programs. Now, some limitations we'll touch on later are cultural differences, implementation cost, user resistance, and platform resistance to changes.
Hi, my name is Presley Sagne, and for our literature review, research shows a growing concern about how social media affects adolescent mental health. Twinge in 2020 found a sharp increase in depression, self-harm, and suicide among U.S. teens after 2012, which she links to rising social media and smartphone use. She points to disrupted sleep, less face-to-face interaction, and cyberbullying as key contributors. Orban in 2020 reviewed several studies and noted that while the overall impact of digital technology on mental health is small, it's still statistically significant, especially depending on the quality and context of use. Perloff in 2014 highlighted how social media intensifies body image concerns in young women. He explains that constant exposure to idealized images fuels social comparison and lowers self-esteem. Vaishnavi et al. In 2025 found that social media addiction is negatively linked to self-esteem in college students, showing how overuse can hurt self-perception and mental well-being. And finally, a New York Times report by Daniels in 2021 shared Facebook's internal research, which revealed that Instagram worsened body image issues and increased anxiety and depression among teen girls. Harmful content appeared shortly after teens created accounts, raising serious concerns about platform design and safety. Together, these studies show that it's not just the amount of time online, but what teens see and how they engage that can shape mental health outcomes.
In 2017, Gallagher released a study that they conducted focused on finding if the relationship between self-esteem and social media usage existed. It concluded that self-esteem focused on different groups of people and found out that those with low self-esteem were checking their post shortly after posting it to see how many likes they got, while others with high self-esteem were not checking as frequently. Then in 2023, a group of researchers studied how social media was related to poor mental health. As a result, it was shown that social media addiction was associated with internet addiction and pubbing. It explained association between them with stress, anxiety, and depression. Later on in 2024, another group of researchers studied how body image, physical traits, and social media affects people's self-perception. It focused on how variables such as culture, gender, and mental health connect. It shows how societies beauty standards and media shape people's self-esteem. Later on in 2024, there was another group of researchers, but their study focused on how social media features may impact teens in their development or mental health, rather than just focusing on their usage. It was revealed that they did not know how much social media really affects teens' mental health. They also claimed that there was other issues such as poverty that may play a role. The review that social media isn't always harmful. There are times where it's useful or supporting. And then in 2024, again, there was another group of researchers that their study focused on toxic influences that may potentially harm children and teens both physically and mentally, that could lead to bad habits. Kids may adapt and develop things such as body dysmorphia by comparing their bodies to these influencers online. In 2021, Wall Street Journal released an article based on company documents that showed Facebook's knowledge of Instagram being toxic for teen girls. It showed issues with social media such as causing girls' body image issues. And then in 2023, Forbes released an article that focused on an approach to enhance safety on social media platforms, showing limitations that may be financial or resources they may have lacked, and showed solutions that may help. And then Cole Arnold in 2022 released an article that focused on strategies to improve healthier personal relationships with technology. It provides different tips on how to achieve that healthier relationship with simple actions such as establishing boundaries that focused on being able to improve mental and emotional health. Then in 2024, Eric Wood published an article on Forbes with primary focuses to show how social media influences young adults' relationships. It brings out issues such as constant comparison to online standards, as well as feeling like they have to portray themselves and the relationship in certain ways. Then Robinson in 2025 released an article with Forbes that focused on Skinny Talk, which is a side of TikTok that promotes thinness, unhealthy dieting, and body standards. Also talked about the mental health issues that come, such as anxiety, depression, body image, and eating disorders.
Hi, my name is Caitlin, and I'll be talking about solutions, ways that we can promote wellness in digital spaces. So we can create digital wellness campaigns for students. We can do workshops, how social media impacts our mental health. We can add strategies to limit our screen time and breaks away from social media. We also can do self-care activities and checkups for students away from social media. We can also partner with social media platforms. Platforms can promote resources and helplines. They can add built-in features for screen time, reminders, and wellness content. They also can reduce constant exposure to negative content, so avoiding any comparisons in the future. So what makes these solutions and why are they effective? By limiting notifications, reducing endless scrolling, and promoting uplifting content, this will manage our online stress. By having built-in wellness features and control over screen times and apps to protect our health, this will create trust and safety space. By having a constant reminder for screen time breaks and easy accessible mental health resources, this will help advocate for our better health.
One major limitation is the financial burden. Studies from the Journal of Digital Health suggest that implementing features like wellness prompts and moderation tools requires substantial investment. And then smaller platforms, according to Forbes Tech, often lack the resources to maintain these kinds of initiatives. Another challenge involves cultural norms and user resistance. According to research in the International Journal of Cultural Studies, social media use and digital wellness expectations vary widely across different cultures. Even when tools like screen time limits are available, many users ignore them or they feel that privacy concerns outweigh the potential benefits. Lastly, platform resistance and policy gaps also play a huge role. Internal reports from Facebook, highlighted by the Wall Street Journal, show that even when companies recognize harm, profit motives often prevent significant changes. Without strong international policies, platforms aren't always held accountable for promoting user well-being.
Moving into the conclusion, the research we have completed here today shows the profound impact of social media on mental health across many different age groups. The effects are the most evident in areas such as image and self-esteem, depression and anxiety, digital addiction behaviors, and cyberbullying. Studies show how the strong correlation pattern between increased social media usage and declining mental health with adolescents and young adults being the most affected. While promising digital wellness solutions have been given, their performance faces many difficulties that include financial and resource restrictions, cultural differences, platform resistance, and policy limitations. Moving forward, helping to create a healthy digital space will require collaboration between many groups of people. We should also bring more awareness and different practices to this topic. Only through these ways can we work towards creating a more balanced digital environment for future generations. Thank you so much for listening to our presentation today.